Good evening, good evening. Oh, we're live. Hi, good evening, good evening, good evening. Thank you for joining. How are you today? I hope you've had a good day. Put it in the chat, please. Let us know where you're joining us from. It'd be lovely to see where the audience is joining from today. Good evening, good evening. I'm just gonna give you another minute and then I'm gonna let it start. Good evening, everyone. Good evening, everyone who's joined. Thank you for joining early. I hope you've had a good day today. How are we all doing? And it's 7 o'clock. Amazing. Good evening. Thank you, everyone, for joining early. I'm just going to go right into it. Before we get started, I see that one of my guests they're now here. But quickly, I'm just going to go to this scripture that I wanted to bring to you. It's Proverbs 19:2, and it says, the best way to live is with revelation knowledge, for without it, you'll grow impatient and you'll run into error. I like another translation, which is New Living Translation, says, enthusiasm without knowledge is no good. Haste makes mistakes. Today my guest and I will be bringing you some facts based on medical researches, research papers, professional and experiential knowledge. But honestly, there's another dimension, which is the dimension of truth. And this is the truth based on the Word of God. The truth I'm not able to speak this evening, but the truth that you know has the power to make you free, honestly. And in John 8:32, if you embrace the truth, it will release true freedom into your lives. I just wanted to bring that to us today. And today we'll be talking about fibroids and fertility. Thank you everyone who's joined us today. I do hope that you'll find this information, education useful, and you can be more equipped to and empowered to ask the right questions, because the major concerns that women have when it comes to fibroids and fertility, and some of those we'll be touching on tonight. But the truth is that fibroids affects women differently. While some women with fibroids are able to conceive naturally, others struggle with fertility challenges. And it can be due to different reasons. Some of the professionals will touch on that tonight. It could be the location, the size, or the number of fibroids. But tonight joining me is a consultant gynecologist, Dr. Kazal Omar, and an amazing lady, an award-winning fibroid and lifestyle advocate, Nina Lemter. I'm just going to find them and try to bring them into this evening so we can get right into this. Bear with me, I'm just looking for my amazing ladies so we can get started for you. Bear with one moment. Just gonna add the Dr. Soha first. Miss Omar, can you please? Okay, let's do this. Sure. I accept you and that. I hope that's worked. Bear with me tonight. Okay, I've got the doctor. I've got both of my ladies. Good evening. Good evening.
Good evening. How are you?
I'm good, thank you. How are you doing?
I am okay. Thank you. Thank you. Not bad. Not bad.
Good evening, Nina. Lovely to have you here.
Good evening. Good evening. Thanks.
Thank you. Thank you both for being able to join me. Are you okay, Mr. Omar? Did you want to settle?
Yeah. Yeah, it's okay.
Yeah?
Yeah.
We good?
Yeah, all right. Okay. Do you hear me?
Yes, we can. I hope you both
Mhm.
have a good day today.
Yeah, not bad, not
All
bad.
right.
Thank you so much. Thank
Amazing.
you.
Amazing. Thank you. Thank you for
Mhm,
joining me today in this conversation. Honestly,
mhm,
it's something that we need to continue to talk about and continue
mhm.
to empower women, with the right information and education to get women to
Yeah.
help their wellness. You are upside down, so that's why I'm smiling, Dr. Ma. You are on your side. I don't know if
Mhm.
okay, so
What
that's better
about
now.
it's okay? Yeah.
Yes, yes,
Okay.
thank you.
All right.
Thank you very much. Okay.
Mhm.
If you go first, Dr. Mo, please introduce yourself. Can you share
Yeah.
briefly,
Yeah.
share
Mhm.
your background and experience that you have in managing fibroids, in the
Mhm.
context of fertility?
No problem. I am Miss Kazal Oma. I'm a consultant gynecologist. I have been practicing gynecology for over 40 years, to be honest, and also involved every single uh, branch of gynecology, especially fibroid, is close to my heart, and also affecting what the fibroid affects in fertility, or what is the outcome of the fertility because of the fibroid. So
Yeah.
I have been involved quite a lot with the fibroid and its problem and how you manage it. Thank you.
All right. Thank you very much for that. So I'm going to go to you, Nina. Please introduce yourself. Tell us briefly about your journey, your work, advocacy work in this space of fibroids and fertility well-being, and and what inspired you actually to get into this?
Sure. Yeah, thank you. So my name is Nina Lemt here, and I'm a nutrition lifestyle strategist. And I felt myself in this space because I had to help myself. Essentially, I discovered I had fibroids through following subsequent miscarriages, and yeah, being told that I had these fibroids, non-cancerous tumors. So it was very scary to hear that. But it was kind of told to me in a very nonchalant way. No pamphlet given, had to figure it all out myself. And I had a myomectomy that could have gone in a whole different direction if I didn't advocate for myself, which I know now that's what I did.
Yeah.
And I've been on a healing kind of journey ever since. And I felt myself constantly speaking with women on their journey, and I was often asked, what I was doing to empower myself, and that's how I kind of evolved
I got
into
into
this.
this.
Yeah.
Amazing. Amazing. Thank you so much. It's lovely to have you both here tonight. And tonight, honestly, my heart is bringing information and education to women, and also based on, of course, professional experiences, and also based on our personal journey. I know, Mr. Moore, you haven't got fibroid, you've got something else, but I mean, fibroid is something that I've had, and of course you, Nina. So some of those, and I'm a big believer on sharing stories. Women can relate more with stories from other women who have been or are going through, and then they can relate, and that helps to encourage them to say, okay, now and for me it's all about bringing hope to women that this is not a kind of a death sentence, or is doesn't mean it's impossible to do this or do that or have this or have that. It's just about bringing that knowledge, bringing information, opening up the various options that there are to help women who are struggling with this. So thank you both, and I'm absolutely grateful for you joining me this evening in this conversation. So it's going to go this way, where I ask a question, and then I'm going to give both of you a chance to be able to bring on your thoughts and or your own knowledge based on however it is that you've been able to get there. So thank you. So tonight, and I do have quite a number. I do most of these are my questions that I've come up with, but I also do have a few that audience have shared before this conversation, and I'm going to try and put that in this 1 hour that we have. So help me God. But Okay, but we're going to start first of all with defining this condition so that we go from the 101. So the first question to you, Ms. Omar, around uterine fibroids. What are uterine fibroids and how common are they among women in reproductive age? And also, while you're telling us what they are, please tell us the types, and why their locations might matter.
The fibroid is a fibrous proliferation of the uterine wall. It's mostly from the muscle side, and they proliferate and make, as any other cell, it proliferates very, very quickly and make this and has a benign condition, of course, and rarely can change to the cancerous change. But most of the cancers which is related to the fibroid, it's happened by itself, not from the fibroid, but can change. It's 1 in 6,000, which is very, very rare. Luckily, it is a benign condition. It's not a problem, but it is genetically motivated. It is quite related to the genetic predisposition of the women to produce fibroid. We have a special classification for the fibroid, which is called a FIGO classification, and this classification is 0 to 7. Each one of them can affect the fertility, but some of them is more. The one which is inside the uterus, which is called submucous fibroid, either zero type. Zero type, it means it is attached to the wall of the uterus, but has no any base inside the wall of the uterus, but it is just sitting inside the cavity. If you compare the uterus like a room, if someone sitting inside the room and attached to the, just from the inside, it's called zero. But if it has any root to the wall, it becomes 1.
Right.
And then how much of it can be 10% of it, it become 50-50, it become 2. And that time is called partial, which is the one which is inside the room. It is called submucous fibroid. Submucous fibroid is basically it's like, you can compare it with a foreign body inside the uterus and can cause infertility because it's like a coil. It is a contraception. It becomes a contraception, especially if it is big enough, which occupy the room. So how the embryo can implant will not implant, and even if it implant will cause early miscarriage, even the woman doesn't know because it's cause heavy bleeding and they think that is their period.
That's the submucous,
yeah, submucous fibroid, and can be attached or affect on the entrance of the tube, where the sperm come in, where the eggs go through. That also causing some blockage of the tube. Right. So submucous fibroid is play very huge part on the fertility side.
Right.
Yeah. And then we have, as I said, a 50-50 inside and 50 in the cavity and 50 in the wall of the womb is called intramural, which is 3. And intramural also have 2 types because maybe completely in the wall of the womb, and that is 4. And if it is protruded to the up, like 50% inside the wall and 50% is projecting to the outside, become 5, and then 6 if it is just on the outside, very little of it, like 10-20% inside the wall, and the one is sitting on the top of the womb is called a number 7, which is called subserous. Right. So we have submucous, we have intramural, could be complete or partial. Even submucous could be complete or partial. Then we have subserous, could be completely subserous, sitting on the top of the roof, or part of it intramural. And there's also other fibroid. This is just the womb. Can be cervical fibroid. Cervical fibroid is a very difficult, also can be affecting fertility because if sitting inside the cervical canal, which is affecting the transfer of the sperm to the egg, and all these things can. Sorry. So transfer also, it will be difficult. So this is a cervical fibroid. There
Okay.
there is some fibroid also grow on the ovary. There is also fibroid. There is the womb have two wings, and these wings also can have, they call it broad ligament fibroid. But broad ligament fibroid, ovarian fibroid, is a bit rare. But most of the fibroid, it is inside the womb, and can be also, the submucous fibroid can have pulling down the pedicle. You know, they are on a stalk, can come through the cervix. So these are this is a type of fibroid, because it's only not only the type affecting the fertility, the size also affecting the fertility.
Okay. So will you say that all of these ones that I think about four now, the submural, submucous, intermural,
Yeah.
and subseral,
Yeah.
are all these ones, which one affects fertility the most?
The most is submucous, but
Okay.
also depend on the number of the fibroid.
Right.
If it is too many intramural fibroid, increase the cavity, the room will be bigger. And when it is bigger, the fertilization can happen, then implantation can be affected. And also the woman end up with continuous bleeding, heavy bleeding, then the fertility will be very, very much reduced by that. Subserous can also affect, but can be blocking the tube from outside. If they are in a wrong place, especially near to the tube, can be make like a blockage of the tube. So unless if it is very small, the intramural, unless it is very small and there is no many of them, or subserous just sitting on the top of the uterus, those two can be not affecting, but the rest will be affecting, because it's not only the location, the type, also the size has effect, and number affect the fertility.
Oh, wow. All right. Thank you so much for telling us the
Okay.
difference of fibers. Thank you so much. So I'm going to go to you now, Nina. But while we're on this, I just wanted to encourage the audience, please, if you have questions throughout the session, please put it in the comment box, and I'm going to try and let the doctor or Nina answer those questions while we're here this evening. All right. So my next question will be to you, Nina. So based on the experience and conversation you've had with women, what are the most noticeable symptoms, and how will some of this affect day-to-day life of a woman?
So the most noticeable symptoms would be heavy bleeding, pressure on the bladder, so constant kind of urination, constipation,
Okay.
and pain. So pain due to pressure, pain due to kind of more inflammation in the areas. So those are the kind of the most common symptoms that are reported to me, and what I also faced.
Okay.
And with the bleeding, particularly on the first couple of days of the period, so like flooding, so where a huge quantity of blood is coming out in a very short space of time. So that impacts your confidence with what to wear, places to go, because you know that you've got accessibility to a restroom, so that change yourself. So those are the most common.
All right. Thank you. And were there also which ones were your personal experience the most? Well, I mean, what did you experience the most in your own personal journey?
My own personal would be flooding and fatigue. Sorry, I left that one. So just feeling fatigue because you've got them literally just draining you.
I hear you.
Yeah, unexplained fatigue, which is you're having a good night's sleep, you're eating well, but you're still feeling quite tired. So that was one for me. And then the flooding, constipation, and bladder. So constantly, there was a couple of times I had a few accidents in public because I couldn't get,
I hear you.
a toilet So yeah.
Well, thank you so much for sharing your personal. And honestly, that fatigue thing, because we miss out the anemic bit of it, because honestly, the amount of blood loss, and because especially when a woman doesn't understand what her normal is, and then you just say, "Oh, I'm heavy." I usually have every period, and I remember that I've had situations where I just knew that I was always tired. And I was wondering, why am I always tired? I'll go up a flight of stairs, and I get to the top, I'm going to pass out. I'm like, this is not normal. Well, I was anemic apparently, and so those are some of the things. Thank you so much, for sharing some of those symptoms, and it's important for women to be able to know what to look out for. I'll be back to you, Dr. Omar.
Yeah.
So,
and the other symptom can be, I have seen women coming on a stick, walking on a stick because of the pressure on the nerve. If it is big enough, can pressure on the nerve in the pelvis and affecting the mobility. And the other thing, I have seen women coming with a clotting of the vein of the legs because of the pressure of the fibroid is big enough, especially in the subserous one, when just sitting on the top of the roof, whether it is in the back or in the front or in the top. It does pressurize on the arteries and vein, and then it causes stagnation of the blood and cause clotting.
Wow.
Yeah, so most of the time I have seen people, they diagnose the fibroid because they come to A&E with a clot.
Okay.
Yeah, so can be, especially the like slim women with multiple fibroid, they are all compact, so it is. And unfortunately, I have a story of the woman, because she has so many clots, but there was nothing, there was nothing you can diagnose the clot. And the fibroid was pressing on the clot. And when, not me, but when she had trying to have a surgery and mobilizing the fibroid, the clot all gone to lung. And post pulmonary embolism. Yeah.
Oh, wow. Interesting.
Yeah.
Interesting. Thank you for sharing that. Thank you so much for sharing that. So my question to you was going to be that how can fibroids influence fertility and pregnancy outcomes? Because I know that you had mentioned earlier on about miscarriages, and I had my share of those as well. And are there certain types? I know earlier on you mentioned the submucous one and the intramural, depending on the number, that can affect fertility. So are there certain sizes, that or type? Well, we already talked about the type, but the sizes that are more concerning, that,
How big
and
size,
what
how
can
that
affect
affected.
outcome of pregnancies?
Because submucous types can cause miscarriage very easily, because the room of the womb is not that big enough to get the pregnancy to grow. So submucous type not only affecting fertility, it's also affecting the miscarriage.
Okay.
And also, if it is many of them, again, intramural, if it is too many, it makes the baby not to like what they want, and premature delivery. Premature delivery, because the uterus is so stretched, the uterus thing, the body thing, that is like the size of the uterus, like a full-term size. So they start to contracting and pushing the baby out. So premature delivery is very common with the multiple fibroid, especially with the intramural. And the lie of the baby, most of the time the women come with a transverse lie, or the baby is sitting on their bottom because the head of the baby cannot come down because the fibroid is in their way.
That.
Yeah. And the other thing, because of that, or because of the problem of the growing of the baby, then they are more prone to cesarean section. And after cesarean section, they are more prone to have more bleeding after delivery, because they don't contract well, they don't do, and also they all congested. And in addition, there is another situation when the patient come to the hospital many times, and some of them, they are months in the antenatal ward because of the pain.
Wow.
Because the blood supply go to the baby, so cut down the blood supply to the fibroid. The pain of that fibroid is like a myocardial infarction. It's very, very painful because it is ischemia by anyway. and that called red degeneration, and sometimes it causes miscarriage, sometimes cause premature delivery, or because of the pain and location you are obliged to have to deliver them because it is too painful. So they are multiple. They are away from home. They are away from other children, affecting the family, affecting financially, and also they have to take time off from whatever they're doing. So it is effective. And then postpartum hemorrhage is very, very, very common with the lady delivered with a fibroid, whether it is normal delivery or cesarean section.
Okay, thank you for that. You know, I know you touched on the ones that can cause miscarriages. Are there which ones to look out for that? You know, because sometimes women are not even able to conceive at all. So which
Yes.
one prevents conception?
Yeah, preventing conception is a submucous. So the woman should, if they have any infertility side, the first thing we do is an ultrasound. I had a lady today, and she went for fertility examination because of other reason for IVF, and they found out that she has 2 submucous fibroids. So if you don't take those submucous fibroids away, she will never become pregnant. Even if you fertilize the eggs and put in a bag, it will not stay in because the surface of the fibroid is not like surface of the line of the womb. So you have to be careful with that. Yeah, that causes infertility quite a lot. It's like a foreign body, like a coil sitting inside the womb. Yeah.
Wow. Thank you so much for that. I'm going to come to you, Nina. But before then, I just saw a question here that honestly I really want to touch on a bit. So there's Nikki Flawless. She says she's had, actually before that, I was going to ask, someone just also put Birmingham Finest that she's had 39 taken out, you know. How does the number also, the number of fibroids impact? Because sometimes when you do all of this and they don't pick all of it, so you never know how many really you have.
Yeah.
You know, until you maybe have a myectomy and then they tell you, oh, we took this out and all of that.
Yeah.
But I also wanted to ask Nikki Flawless question. She said she's been through a lot of health issues, fighting infertility for years with multiple huge fibroids, fallopian tubes blocked. Is it possible to get pregnant at 41? Please, I want you to help answer her question, because what I want you to do is connect the numbers of fibroids to also the types, you know, because obviously she's got multiple and she's still on the journey of trying to get
Multiple
pregnant at
fibroid is
41.
a problem because you have, if you even with multiple fibroid, when you do the myectomy and taking them out, unfortunately the scar of the myectomy is so sticky. It's like a plaster. It does cause a lot of scarring and blockage of the tube. So that's another issue for the fertility. And if you have multiple, I have taken 75, I have taken 125.
From one person,
One
75,
person.
did you say?
One person.
Oh,
And
wow.
imagine this, not only the fibroid will come out, some of the normal tissue of the womb. So it is affecting the quality of the womb.
The womb.
It affects the quality of the muscle. It affects the quality of the inside. So a number of the fibroid and size of the fibroid will affect the quality of the womb. And also, if you're taking it out, definitely it causes scarring. Rarely the woman can be pregnant naturally after having a myectomy because it affects them. You never know if blockage of the tube is happen one side or both sides because of the scarring. There will be and the scarring of the fibroid is different from any scarring you ever known. It is like a glue, like a glue. Yeah.
Wow. All right. Thank you for that. I'd like us to address that question again a bit later, just so that we're able to proffer solutions for Nikki Flawless and see how we can get her to a place where she has hope of fertility at 41. But I'm going to come to you quickly, Nina. So in your own experience, you know, from your perspective, how does all of this, how does this challenge of fertility, how does it affect women, especially emotionally, you know, and also how, as the women you've worked with, or even if it's your personal story, how has this been a challenge challenge for you, if it has?
So even though I wasn't trying to conceive when I did conceive, and then subsequently had the miscarriages, obviously I was made aware that I couldn't carry the baby because of the positioning and the sizes. So in my case, it was the sizes of fibroids. So yeah, implantation wasn't an issue. Now, in regards to like conversations, the main issue is implantation, I think. From there seems to be a high issue with that and fibroids. And I think in regards to, like, I suppose, confidence with your body, because the guidelines appear to be women are being told that it's genetics and there's nothing they really can do in regards to diet. You can feel quite helpless, frustrated with your body, with yourself, and of course you end up internalizing that and further creating more issues in regards to stress hormones, and it can just keep
Cycle goes on and on.
goes on. So it's so important for women to know that there is a level of, I suppose, empowering they can do, maybe through diet, nutrition and lifestyle, and then kind of combining the guidance that they're getting from their consultants, and gynecologists with
Healthy
what
lifestyle.
themselves, because I think just the clarity and that confidence that, okay, I'm taking action is a more positive, stepping stone, as opposed to, okay, this is just genetics, and when end, that kind of thing, and it's just like they cut them out and they grow back. It's quite a negative cycle and a negative situation.
Yeah, thank you so much for that. And honestly, we're going to touch on, I'm going to ask you another question later on, because I really want us to also touch on the healthy lifestyle, and also how having fibroids can also impact well-being, mental well-being. Especially, I've had a situation where I had a really horrible consultant. Every time I went, I was made to feel like it wasn't a big deal. Why are you making a fuss? You have fibroids. So, I felt really like my pain was minimized, for a very long time. So, and I just think, am I just exaggerating this thing in my head? You go home and think, okay, maybe I need to hold myself a bit more and just manage this situation more, all of those kind of things. But I am big on joining communities, joining support network where women are talking about these things, and women can learn to advocate for themselves and speak up and push back when somebody's minimizing, what you're really going through. Thank you both for that. So I'm going to quickly go to how treatment options. Honestly, I'm going to go with you first, Ms. Suma. There are various ways to diagnose fibroids, but what's the easiest, quickest, when someone, first of all, how a woman who, at what point will she know, okay, this bleeding is not my normal? Because some people might just be heavy bleeders, if you like. And at what point will she know that, okay, this is not normal for me? I need to start to look out, and what should women look out for to be able to say, okay, maybe I need extra screening or extra tests done to see what's
Yeah,
wrong?
by nature, people think that the heavy period is normal, and 2 to 3 days. To be honest, the first, most of the period is the first day is not, but second and third maybe. But you have to know, if you are taking something advised by the doctor to reduce the amount of bleeding or amount of the pain, if that not touching you, there is something wrong. It can be making you to not go out, can be changing their sanitary towel or tampon or double or whatever. It is a larger size every half an hour. There must be something wrong. And pain, the pain, why it is so painful, and lasting for 7 days. is a maximum. When it is lasting for 10 days, 15 days, I have seen women coming in their 30, still they don't know what they have, but they thought that's normal because the family always said, oh, the period will be heavy. But heaviness make you anemic, make you not be able to walk. It means it is abnormal. It is something abnormal because this blood is not a period blood. It's coming out from your body because the vessel is not contracting. It has to be contracting. It has to be clotting. When it becomes too much fresh blood coming out, when it become big clots coming out, these are really a sign of when you take in any paracetamol, ibuprofen, mefenamic acid, whatever it is available to you and it's not touching you, this is something abnormal. You have to be checked. And the best tool, sometimes people even in the morning when they have a full blood, they just lie down in their bed and touching themselves. They find a lump in their abdomen and they come and that's their diagnosis. So yeah, heavy period, causing you anemic, cannot walk, cannot go out for 2 to 3 days, lasting for 7 to 10 days is in heaviness side. That's not normal. That's not normal.
All right, thank you for sharing what to look out for. Quickly, I want you to answer someone's question and then I'll come to you, Nina. Favolin's perfume says, can someone with intramural fibroid of 7 centimeters get pregnant?
Yes. Yeah. Lots of people get pregnant. Unfortunately, if you look on the mothers and grandmothers, because they tried for pregnancy very early in their life, so they become pregnant and later on they knew about it. But unfortunately now people are minimum age, you see 32, 33. So this fibroid has been growing. But 7 centimeters, yes, can be pregnant. I had it depends also intramural fibroid. Yeah, they can be pregnant as far as it's not distorting the cavity, distorting the room. Yeah, they can be pregnant. A lot of women, they didn't know even they have a fibroid until we did a cesarean section for them, or they had a scan during pregnancy. Yeah, they can be. It's just, to be honest, sometimes you can call it luck. Someone is lucky, become pregnant, and pregnancy carry on, and they see it during and someone even small one, if it's sitting inside the womb, they make them infertile or causing them miscarriages. So it is just sometimes I can call it luck. Someone is, but how younger age, how is the pregnancy can happen easier, and the size is much smaller. Although I see very big fibroid in a younger age also. So it is just so much difference from one person to another.
Wow. Thank you for that. I'm going to come back to you later on. But quickly, Nina, what lifestyle changes have you found to be effective? You know, is either through your own personal journey or through women that you've worked with. Any specific nutrition that you would like to highlight? You know, any tips that you think has worked or has been working for people that are in your community?
Sure, yeah. Definitely strategic supplementation and really kind of assessing your day-to-day activities and your demands, and just strategically supplementing to support those grey areas. That was a game changer for myself, and introducing regular exercise, and not just kind of exercising, but actually making sure you're replenishing lost electrolytes and key amino acids, and just making sure that your body gets what it needs. This is really, really effective with energy levels, and just making sure that your body is getting what it needs throughout the day.
Amazing. Thank you for very much for that. Dr. Omar, I want to come back to you around treatment. I know we've mentioned mammectomy earlier on, but I just wanted you to touch more on other kind of treatment options that there might be available for women, and which one's preferable if one is still, if a woman's looking to still have children and conceive, or looking to,
much as possible, the myomectomy is not the first choice, to be honest. Because as I said before, it causes a lot of scarring, and this also causes another infertility problem, and also the rate of recurrence, especially if you do myomectomy in the young age, then the rate of recurrence is quite high by time before menopause or during menopause.
Right.
So the myomectomy is not the first choice. The size of the fibroid and number of fibroid will give you some idea. Each patient what they need to. If there is one of them, which is a tablet, the tablet, unfortunately, from my experience, I gave it to 5 women. After a year, they were very, very happy. It became reduced in size, but during that year, they shouldn't be pregnant. So during first year and become, as soon as they stop the tablet, it come back the same size, come back the same size. So it did come back. So how long we are allowed to use, and if the women want to be fertile and have a children, that's a difficult thing. You just carry on with the tablet, and they can not be pregnant during the tablet. That's one of them. Second one, in term uterine artery embolization. They block the blood vessel to the fibroid. Basically, not for submucous. It's not a treatment for submucous. Intramural and subserous fibroid is very good for that. Unless if the woman finish the family, still they can use submucous one, but this is not for someone seeking fertility. Reduce the size of the fibroid by half, and also the change it make in the fibroid, they will not grow again. But there is a small risk. This blocking can go to the blood supply, which is supplying the ovary from the uterus. Although ovary have other blood supply, but still 5% chance to become menopause.
Wow.
So in one way, you're treating the fibroid, but then you're making her menopause. So at least I believe if we send anyone with many fibroid and needing uterine artery embolization, and they want to make it smaller and they don't want a surgery, I think egg freezing is good beforehand. Because if you have the eggs freeze, even if the ovary doesn't work, then the IVF cycle can be successful, and or embryo freezing if they have a partner. If it is too big, too pressurized in the body, in the bladder, in the bowel, on the nerve, on the vessels, many of them there, to be honest, embolization is very risky, because cutting blood supply to all these fibroids may cut the blood supply to the womb, and then they end up with an emergency hysterectomy. So the myomectomy now, it come into position. You have to do it. You have no choice. And just that woman is, IVF can be, even if it block the tube, you have to encourage them as soon as possible to start the family. If not happen within 3 to 4 months, then they should go to IVF. Even if the blocked tube, their ovary is working, their womb is in the right size, why not?
Right.
And of course, if the fertility issue, we're not talking about the hysterectomy.
Yeah. Wow. So how do you then what approach or treatment approach do you have, or what treatment planning do you have to actively to help women who's actively still trying to conceive, but they're living with fibroids?
As I said, it depends on the type. If it is submucous, we do a resection, we do a surgery. We have to take it out and make the line of them smooth and nice, and to fertilize and implant it in. And the rest, if it is intramural or subserous, it shouldn't affect the fertility unless it's blocking both tube, which is rarely that happens. Intramural, with each woman, you have to take it individually. There's no sisters, even if they are twin, can be treated in the same way for the fibroid.
I agree. Yeah. True. Oh, yeah. Interesting. Yeah. I'm going to come to you now, Nina, but I'm going to say something. But my question to you, Nina, is how can women better advocate for their health needs, like someone who's still trying to conceive, when discussing treatment options for fibroids? While you're thinking on that, that's the question that I would like you to answer to help ladies here tonight. But I was saying yesterday, I joined someone's live yesterday, and they were talking about embolization, you know, and I got offered embolization. Even, I mean, it was much later. I was none the wiser. I thought, oh, okay, easy way out. I was happy to go along with that, but Trust was trying to get funding, you know, and eventually I did a bit of digging, and then I was asking some questions in my next planning session. Was how I found out that some of it was not going to even be able to be removed because of where they were, you know, and all of that. And I said, so why is somebody offering me embolization if it's not even going to solve my problem? And at this point, I've been bleeding for almost 2 years, you know. So what will you be your guidance, Nina, to on how women can advocate, you know, when discussing advocate for themselves when discussing their treatment options?
Yeah, I think it's really important to get more clarity. Well, I'm not saying more, but if you're lucky to be diagnosed when the fibroids are small, you know, significant, to get kind of actionable steps that will allow you to empower yourself and kind of mitigate potential. So rather than just being told, okay, if you've not got any symptoms, just carry on as you are, and then just kind of waiting till they continue to get bigger, actually seek for what they can do. That's getting nutritional advice, you know, looking, you know, at their council if they offer those kinds of services, just really taking more action when fibroids are small, rather than it being deemed not a problem and don't worry about it kind of approach. So I
Yeah.
think just taking it more seriously, you know, because if it was growing on the side of your face at 2 centimeters,
Visible.
it would be quite concerning, wouldn't it? But you know, it's just, I think that's quite key in regards to focus. Now, when because I speak with women that are kind of in their 30s or late 20s, and they're kind of told, okay, since you're not wanting to conceive, just take these hormonal injections or the tablets. But that is going to really bring a level of disruption that they're not really prepared for as well. So I think just having a clear understanding of the impact of that and the repercussions potentially, and what that will look like, you know. So just really more, I think more information around the treatment options. I feel like that's lacking, based on the conversations that I'm having.
Interesting. Thank you for sharing that. I mean, I guess with my own personal journey, it's, yeah, like you said, there's not enough information. You get, I mean, I've had a procedure before that I was in the hospital, and I was told, that's the procedure we're doing. There you go, go and read up about it, you know. And so the truth is, the individual's health is actually your priority, is your business, really. If the caregiver is not about to look after you, you need to know how to look after you. So I'm always saying to women, do your due diligence, get information. Google is your friend. AI, okay, don't go only by Google's information, but get some bits of information that can help you ask the right questions when you get into the room, you know, with your doctor or someone who's able to help you. And that's really key. I'm going to let this go into food, honestly, because I know that you're big on food and lifestyle. So help us, you know, with how lifestyle, or what kind of food have you in your journey, in the women that you work with, has helped, you know, when you're going through fibroid? What's been helpful? What's helped with the struggle?
Yeah, absolutely. So improving gut health and reducing inflammation, oxidative stress. So following more of an anti-inflammatory diet is very key. Reducing processed foods, refined sugars is really, really key. And this just helps the how your body is digesting food and your gut health and absorption, you know, how your body absorbing nutrients from your food and equally from your supplements. I often speak with women that say, okay, I take supplements sometimes and, you know, when I remember, and they're kind of stuck in a situation where they're not seeing any shifts in the size of their fibroids if they're trying to kind of manage them and shrink them, but it's due to kind of poor absorption from in regards to how their body's functioning and absorbing the nutrients from the supplements. So a lot of it is just going straight through their system and they're just kind of lacking. So once you support the body in that way and kind of remove all the fillers and what's kind of causing a lot of congestion and compromising the cells, you find that you feel a lot better, your energy levels improve, your digestive processes get a lot more efficient, you know, you're eliminating waste much more frequently, and this is really key for that I find.
Any particular food you think to be avoided if you're dealing with fibroids? Any tips? Any maybe a couple of foods you think to stay away from if you're dealing with fibroids?
Yeah, red meat, dairy, due to the, you know, the hormonal aspects and acidity that it creates. Alcohol is key areas that you want to avoid, and just processed foods that are designed to stay on a shelf, because there's so many additives and preservatives that are added to obviously preserve the food. So just eating clean in the sense, you know, cooking your food yourself because you know what you're putting in regards to the ingredients, and just avoiding processed. So eating more whole foods, you know, drop from a tree, grow out of the ground kind of thing, and just avoiding kind of bleached flours like white flour and wheat is key as well. A lot of women struggle with digestive issues because of those kinds of processed flours.
All right, thank you for that. Someone's asked anyway, is red meat bad for fibroids? Which you've said it is. And someone also asked about bread earlier, and I think I saw somebody saying, oh, what are your thoughts on eating bread? And something about yeast. So
yeah, so with bread, going for, I think personally it's good to just take some tests to see what you're like sensitive to, because that will help immensely, you know, in regards to the grains you can focus on. I personally kind of avoid gluten because I noticed that really disrupts my balance and my gut health. So going for gluten-free, like rye bread and the sourdough, which is fermented to a degree, that's more, you know, ideal than kind of white bread. So it's not that bread's bad, but just look at your frequency and then the grains that you're opting for.
okay. All right, thank you very much. I'm going to because of our time, I'm going to quickly run through a few myths and facts. All I just want is yes, no, so that women can just be better informed around some of the myths, you know. But I wanted Dr. Omar to answer a question about that someone posted around thoughts on RICO. But I also wanted to ask, well, quickly, let's just do the myths first, and then now I'm trying to be under pressure for the time. So the first one you actually already answered. Is it true that having fibers can always lead to infertility?
It's not
All right.
always. It's not always. It's not
Okay.
always. Everyone's body is different, and can be from time. You should be very careful with fertility, and having a baby is two people. I have seen people concentrating on the fibroid of the woman and doing everything, and then the man, it was a problem. So you have to be careful also. The fertility is making a baby is about two people. So it's not always affecting the fertility.
Okay. Thank
Yeah.
you, Dr. Ma.
Mm,
Trying to make
mm,
it brief, please. Some believe fibroids are only caused by hormonal imbalance. Is that true?
No.
Okay.
Unfortunately, we still don't know exact reason, but genetic predisposition is the most important thing. Of course, if there's no hormone, it doesn't grow.
Mhm.
Um, not the imbalance is not about imbalance. The estrogen is stimulating the fibroid, and the estrogen is the main hormone in the body of the female. And when we lack in, we get menopausal symptoms.
So, but that contributes to it.
Yeah,
Yes, imbalance can contribute.
contribute. Yeah,
Okay. Thank you.
contribute. Mm.
Can birth control pills shrink fibroids? Is that a myth or is it true?
No, it's increased fibroid, to be honest, because you are in the natural cycle, you have low and high amount of estrogen. But if you take in birth control, you daily pushing the same amount every day. It doesn't reduce it. No.
All right. Thank you. Can fibroids grow back after treatment? I want you to answer that, Nina.
Yeah.
Yes.
Yes, fibers can grow back,
Yeah.
especially if you have not started
Mhm.
a different alternative lifestyle to help them not come back. They can't come back. Also, this is for you, Dr. Omar. Can women with fibers have a healthy pregnancy?
Yeah. Yeah, I have seen people, they have fibroid, you do a scan, it depends on the size of the fibroid and location of the fibroid. Yes, they can have, if the cavity is absolutely normal, some fibroid there and here, small size, it even not affecting the pregnancy and it just go by and they have normal delivery. But if the size is big, will be affected by the blood supply and they cause red degeneration and then they spend most of the time in the hospital and other problem with the fibroid. But it depends on the size and the numbers. Yeah, we have seen so many people having 2, 3 children, then they come later on. The fibroid is a problem, but wasn't a problem during pregnancy.
Oh, amazing. Okay, thank you for that. I wanted to ask this question. I have a few more questions, but I'm going to just
Mm,
let
mm,
those maybe be for another time. So, I do have
mm.
fibroids, but no symptoms. Do these asymptomatic fibroids affect my ability to conceive? And what
No,
will
must
pregnancy
be
outcome?
just sitting on the top of the woman, not affecting heavy period, not affecting her ovarian function. And if she has a scan, she should know where it is. Maybe not affecting. No.
Okay. All right. Thank you. I'm going to ask you one more question, but in the meantime, Nina, I'm going to come back to you. I'd like you to talk. Nina has just written a bestseller book, and I want you to tell us a bit about your book and where we can find it.
Mm,
So back to you, Ms. Omar.
mm, mhm.
I know you touched on this earlier on. Can womb sparing operations such as myomectomy improve fertility outcome?
Yeah, yeah, it will prove, because if the woman is infertile because of those fibroid, at least 50% it will improve the outcome and people become pregnant. But as I said, most of the women, when they go to IVF, and because of the fibroid, even in the way to take the eggs out, so they have to have these fibroid removed to have access to the ovary, to have access to have IVF. So yeah, it improved the fertility outcome, of course.
Amazing. Thank
Mm,
you. Thank you very much. I'll
mm,
come back to you on your last words for
mm.
the night for ladies. But in the meantime, Nina's got a new book, Beyond the Surgery: Life After
Oh,
Fibroids, Beating the Odds Through Nutrition. Tell us a bit about that and how that's worked for you, because honestly, because you've lived it and you can share with women, and that's why you have a book. Tell
mm.
us a bit about the book and tell us where women can find this book, and let's go and grab one.
Yeah, sure. So thank you. It's basically a roadmap for any woman navigating. Often I'm asked what causes fibroids, and I have to say there's no, clear, conclusive reason that's been established so far.
Mhm.
However, there are factors that you can address and you can address them very proactively to reduce your risks. And, you know, like Dr. Amar said, unfortunately, some women are more predisposed than others in regards to genetics. However, you can take a level of, you know, action in those key areas. So the book just covers some really key areas with step-by-step guidance to really just get the momentum going. And mindset is a big thing as well, because with all of this happening, life is still happening. And you just, you know, get that, I suppose, process for yourself and really figure out what works for you and just keep working it. So the book will, you know, support any woman that wants to really create a strategy and approach it daily with focus.
Amazing.
And in Amazon, just search Beyond the Surgery, and all the big retail book retailers. Yeah, it's all there. So yeah.
Amazing, amazing. Congratulations and well done. Well done. Well done. Thank you very much. I'll come back to you to share the last word and what you want to leave women with tonight. But in the meantime, Dr. Omar, can you quickly, briefly, oh God, it's 8 o'clock, briefly touch on RICO? Someone wanted to know. And then Nina, before you give the last word, someone's also asking around eating too much yeast. What's your thoughts on eating too much yeast? I think in bread or in sugar or whatever thing that, yeah. So, but Dr. Omar, any thoughts on RICO? Someone wants to know the.
It's the best thing is early diagnosis. That's the most important thing. And when there is early diagnosis, there will be early management. Does not mean that the surgery. I mean everything: nutrition, medical or non-medical treatment, and surgical. Early diagnosis is very important because from the teenage, if the family have a fibroid, especially with a family history, the mother, the other sister or auntie have a fibroid, it's good to be excluded. Yes, this is not guaranteed that by age of 40 they will never have a fibroid, but at least they know now there is nothing, because I have seen it in 24-year-old with a big fibroid. It's just not fair not to know. Early diagnosis, early management, as you said, non-medical treatment from the beginning, nutrition, lifestyle, all these is very important. And then if it comes to the fertility, it will be prepared very well before starting to waiting for years to become pregnant and then find out the reason. So, yeah, surgery is not always the case. No, surgery is not always the case, unless if it is. And I weigh every single woman according to their age, their fertility, what they will and what to do, and number, and size, and location, and future.
Amen.
Yeah.
Amen. Thank you. Every woman is peculiar. So, about personalized advice with your healthcare professionals, very important. Making sure that whatever it is that has been planned for you is what works for you. Thank you very much, Dr. Omar. But quickly, somebody's asking about I think is a medication called RICO.
RICO, RICO. The RICO is a problem. This is a tablet which I talking about. It work within a year, become half a size. If you stop it, come back. Yeah, but RICO unfortunately also cause some menopausal symptom. Imagine. It's good. It's good if the woman doesn't want to have a fertility and things. Then they don't want any surgery. They don't want any arterial embolization. It is very good. But up to now, it is licensed for 1 year. After that, after 4 months, 6 months of stopping it, you have to have another scan. Just make sure that it's not increasing size again.
Right. Thank you for clarifying that. Thank you so much. So, back to you now. What final message of hope and support would you like to share with women on this journey?
Just hold on to the vision that you have, because that vision will support you through the moments. You know, we will be told by our, the consultants, the doctors, the bigger picture that can often be quite daunting. So I think just to support your focus and you being able to take action daily in the direction that you want. Have a vision board, hold on to your vision, let that inspire you, and you know, whatever, if you've got a faith, believe in that faith. And yeah, that's a powerful tool just for your emotional well-being. And obviously and the doctors, what the doctors say isn't final. Obviously they can make mistakes, but it's just about believing in what you want, and obviously taking action with the right guidance and support. So get that support and guidance.
Absolutely. Thank you very much for that. And it's important, honestly, to be able to find a support system, find a support network, you know, and every woman is different. There's so many options. Explore the options, you know. Don't let anyone throw anything at you and say, oh, you have to have mammectomy, or you have to have this, or you have to have that. You know, do a bit more digging yourself. Speak to people who go to communities where these things are being talked about, you know, have conversations, you know, hand holding. Even nowadays, you could go with an advocate to your appointments, you know, someone who can help you ask the right kind of questions and all of that. And that's what people like me and myself will do, you know. So join support groups like the Feminine Health Fibroid Network, the Womb Care, Dawn Hill's there, Women Talking Fibroids. There's a lot of advocacy and women group there having these conversations. We cannot be quiet anymore. We cannot keep being shy or people are going through these things, are talking about it.
Yeah.
And if you don't speak up, no one knows what's going on. No one can help you. Please, let's talk about these things and let's help each other. And honestly, and everything that we've provided today is educational. But every other thing that you might need will be personalized to you, you know, with your healthcare professional. You know, thank you very much, everyone who's joined today. I hope you've been able to take away something. Some of the resources where you can also look up stuff includes NHS UK, the Mayo Clinic, the London Women's Centre, British Fibroid Trust. You know, there are a few papers also that you could, articles that you can look up, you know, whatever thing you can do to just be empowered, have the information that you need, you know, to come to your decision that you're going to be happy with, you know, even on this journey. Thank you everyone who's joined today. I hope it's been useful, and thank you to my guests who've been able to come to share their, you know, experiential knowledge as well as the professional knowledge. I am absolutely grateful. Thank you everyone, and thank you both
so much. Thank you. Have a good evening.
Good night everyone.
Bye.
Good night. God bless. Good night.